welcome to the Kitty Cares Skin Center and Dermatology Clinic. Thank you so much for being on time for your appointment. You are the 3 p.m., correct? Okay, great. Alright, I'm just going to have you verify your first and last name and date of birth. Okay, excellent. Alright, so I read your check-in report, and this is your first time here, right? Okay, not a problem. You had some issues with an itchy scalp, tingling sensations, and numbness in the face. Okay, and when did this start? A couple weeks ago. Okay. Alright, and just visually, have you noticed any redness, any lesions, any bumps? Okay. Alright, have you done a lice check? Alright, great. Well, we're going to do that for you, absolutely. It is the winter, so dryness and flakiness is very common at this time of year, but it's really important to make sure that there's nothing more serious. So on a scale of 1 to 10, how would you rate your level of pain and discomfort right now? About a 6, okay. And could you point to the area where you would say it hurts the most? Up here, okay. Okay, we're going to get that checked out, absolutely. Do you have any known allergies to ointments or tinctures? Okay, any allergies to any medication at all? Okay, penicillin, well, that's really good to know. Okay. And any changes in your daily medications? Alright. Okay, and do you take any supplements for your skin, such as flaxseed oil, fish oil, MSM? Okay. Okay, so those are some things I recommend just for a baseline care of your hair and skin, is to take fish oil, is to make sure you get salmon in your diet and things like that. And if not, then definitely supplements are the way to go, okay? Alright. Do you take vitamin D? No? Okay. Okay, so I'm just going to have an initial look, okay? I will be sanitizing my hands and then applying gloves just to make sure that the whole area is clean and that I just see your skin on a clean slate, okay? Okay, very good. Okay, how was your morning? Good. It is 10 degrees outside, so I hope that you bundled up. Absolutely. Okay. 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 Alright, great. So if you could just hold still, I'm going to be doing some examinations, and then I'm going to be using a series of brushes, and then we'll go from there. Okay, great. I hope you don't mind. I just ate lunch, so I'm just going to pop some gum in. Okay. Okay. Excellent. So I'm just going to take an initial inspection here. I'm just going to be looking. Okay. Okay. Just looking on your scalp. Just looking. Okay. Okay, just turn your head slightly, okay? Very good. See any visible lesions. I don't see any lumps or bumps. I'm just looking for visually. Okay. Okay, and just turn a little bit here. Just going through your hair. Okay. Excellent. Okay. I'm just be checking at the top of the scalp here. Okay. I do see a bit of flakiness at the very top of your scalp. Alright, but that is very common in the winter, but that is in the area that you were having pain. Okay. Alright, I'm going to be sure to send you home with a special conditioner that's really going to help with that. Okay. Great. Okay, hold still. Okay. How does this feel? Any pain here? Okay, any pain here? Okay. Alright. I'm going to palpate the area, okay? So just remain still. And this is just to check for any inconsistencies in the texture of your scalp, any lumps or bumps especially. Do you remember having any kind of falls? Okay, no falls. Great. Okay, and how do you sleep? What's your sleeping position? Okay. Okay, on this side, that shouldn't be a problem here. I'm just feeling that. Okay. Very good. Okay, still touching the back of that. Okay, I do see. This is you good, Thunder. Okay, I do see a mole here. How long has that been here? Okay. Has it? Alright, it's been there your whole life, okay. I'm just gonna look and make sure that the symmetry is okay. I see the mole is symmetric. I don't see any irregularities or any irritation in the mole area. So if you've had it since childhood, okay. What I would do is have you or a partner or someone that you live with just do some regular checks of the mole every few months, you know, just to stay on top of it. I am going to take a small sample just to make sure that the mole is benign, okay, but I'm not too worried. This is just preventative, okay. Great. So just keep your head right there. Very good. Sorry if that pokes. Excellent, okay. Okay. Thank you for being patient. Very good. Okay. Alright, I'm just going to keep palpating the area, okay? Yeah. I'm gonna feel, just gonna get by in the ears here. Okay. Okay. So I noticed no lumps or bumps or irregularities in the initial texture of your skin, but I'm gonna be going through it with a brush and a few different brushes. Okay, just to get the sense of the texture of the hair and some samples of your hair follicles as well. Okay. Okay. Right. Okay. So this is the first brush I'll be using, okay? Just a generalized flea and tick comb, okay? But also really is good for taking samples of the area, okay? Okay. Great, so just hold still, okay? Okay. Your hair is very tangly, and you have a lot of it, but it's just gonna take a bit of some time. Okay. Very good. Excellent. All right. I'm not seeing anything right here. I'm just going to take an extensive look, okay? Right. I do see a small fleck, and I'm not sure what it is. It probably is just a dust or a piece of fabric, but I'm just gonna take a quick sample to be sure, and then we'll move on to the next brush, okay? Okay. 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 Did you notice some dryness in your hair? Have you switched shampoos in the last 2 weeks? Alright, why don't you go through your hair care routine for me? So, okay, and how often do you wash your hair? Okay. Okay, that could be the culprit right there, because especially in the winter months, using a lot of that shampoo every day can strip our hair of its natural oils. And maybe just use shampoo every other day. You don't have naturally oily skin or scalp, which would be a reason why, you know, it might be a good idea for some people to wash every day, but you're nice and dry, okay? So your hair needs to build those natural oils, okay? Okay, and I'm just gonna make sure that this is primed for you. Okay. Okay, just take a deep breath. This is just to gather a sample for the texture of the hair. I already noticed it was dry, but just when we have an official report to send to the lab, so I can send you home with the best topical treatment. Okay. And what time of day do you say that you feel the tingling sensation? Okay, it's pretty much throughout the day. Okay, that's really good for me to know. Okay, so I'm gonna send this sample to the lab. Okay, you're doing excellent. Alright, I'm just gonna write it down. Definitely gonna be finding some shampoo and conditioner for dryness for you, okay? Right. Alright, and before we move on to the next brush, I'm just going to be applying some oil, some treatment, okay? And this is just going to make the area more clear and visible and just give you a nice cleaning in the area. Okay, very good. Alright. Okay, so just hold still. Very good. Okay, it might feel a little oily at first, but I promise you that your scalp and your skin is going to love it. So just Take a deep breath and relax, okay? I'm just going to really massage that in. Nice, okay? Alright. Next I'm just going to use this brush, okay? And this brush is just to kind of smooth in the area, just to make sure that we have the samples that we wanted to take, okay? Great. So, and this is also to detect dandruff, okay? So just okay. So you have a lot of hair here. Okay, great. And next I'm just going to take some samples, okay? So I'm going to be cutting, using the scissors and just cutting the area, okay? I'm going to be giving you a little haircut. Great. And just trimming. I do have a certified degree in barbering, so I'm a very excellent barber. And I noticed that you have some just loose right here along the beard. Yeah, so I'm just gonna be cutting along the area. I'm just gonna be making sure that it's nice and clear. Okay. Do I have your permission for that? Okay. If you could hold still. Okay. Let me just wipe some of them. Let me just wipe some of the oil on the beard, okay? Just wipe it right along the line. Very good, okay? Excellent. I'm just smoothing the beard down before I do some cuts. Do you mind? Okay. It does smell like Christmas tree, yeah. It's a very potent oil. It's all natural ingredients. Okay. Before I do that, I'm just going to be taking off my glove. Okay. And okay. I haven't done a haircut on anyone in years, but like I said, I do have a degree in hairdressing. I'm just not very practiced right now. So you can be my little guinea pig. Do you mind? Be my little guinea pig. Okay. Alright, this is very, kind of getting into this, so let me just get okay. Some of that, yeah. We'll clean that up later. Fell to the floor. Okay. Messy barber. Alright. And also, it's not this hair trim that you need is going to really help, me inspect the area further. Get some of that hair out of the way so I can just kind of peel in between the follicles and really get to the bottom of the problem. Okay. Just a few more. Very good. Okay. Plenty of samples to send. Plenty of samples to send to the lab. Very good. Excellent. So that's very good. Okay, and I did notice some stray hairs along your eyebrows and along the face and also on your nose, so I'm just going to pluck away some of that. Okay. Alright, great. But first, I think it'd be good to apply some ice to the area just to numb it, because I know that the picking sensation can sting. Okay, but it's for your own good. I just want to make sure that you're healthy and trimmed. Okay. Okay, so let me get that ice for you. Okay. Okay. So I'm just going to apply this just to the bottoms of your eyebrows. Okay, it feels cool. Alright, and this should really help too with that redness and tingling sensations that you mentioned. Okay, good. Let me get the other side now. Okay. Excellent, excellent. And being very patient with me. Your hair looks amazing so far. I won't show you a mirror yet because I'm not finished, but it looks very good, so there's no need to worry. Okay, okay, very good. It's gonna ice your whole face. It's a cooling. Okay, should feel like a very cool sensation. Okay, I'm gonna go on the tops of your head too, because I'm gonna get some of those extra hairs too with my tweezers. If you're wondering if my hands are getting cold, they are. Okay, slowly. Okay, are you anxious? Don't be anxious, trust me. Just take a deep breath, okay? Take a deep breath. It's gonna be fine. You're fine. Okay? So it's very good tweezers. I just want you to hold still for me. I'm just gonna. Okay. Good. See, the ice really helped. You don't feel anything at all, do you? Very good. Okay. Okay, and some of those chin hairs, some of the hairs on your chin, on your tinny chin. Okay. Okay, excellent. Okay. Alright, so next, I palpated the back of your head, and I'm just going to feel your face, okay? Alright, first I'm going to wipe some of that ointment on your face. Actually, this is for your skin in your face, okay? I noticed that there was some dryness in your face. Okay. So just let me, I'm just gonna rub this. Okay. Okay. So I'm just gonna, okay, very good. Just gonna rub it on, okay. Yes. Excellent. Excellent. Are you feeling sleepy? Okay, that's okay. You're allowed to sleep in this clinic. Okay. Alright, and just some preventative eye drops. I just want to make sure that when I palpate your face, I don't get anything in your eyes, and this is to lubricate the area for protective reasons. Okay, so I'm just going to drop some. Okay, very good, very good, very good. Okay, excellent. So then I'm just going to apply my hands coolly against your face and just palpate it, okay? Okay. Does that feel better? I feel more moist. That's very good. Okay. Very good. So you should feel very soothing. It's infused with aloe vera as well. Okay. Alright. Now relax. Relax. Okay. Very good. Now you're trimmed and fresh. Excellent. Excellent. Okay. Okay, so you're starting to feel a little more relaxed. Are you? That's very good. I'm glad to hear that. Okay. Great. Okay, I'm just going to add a serum on top of that. That's going to heal the area and really help with loosening up your cellular movement and the blood flow. Okay, so what I want to do is get the blood flow going so we can get those sensations back, and you're going to do a sharp and dull test. Okay, so I'm going to be stimulating blood flow. Okay. Very good. Very good. Okay. Alright. So I like to do a sharp and dull test, okay? Alright, I just want to make sure, because you mentioned loss of sensation in the face and numbness. And with the tinctures I applied, if there is no underlying problem, you should start to be regaining some of that sensation. Okay? Alright, so close your eyes. Good. Alright. This is going to feel sharp, and this will feel dull. Okay, so just tell me what you feel. Good. What side of your face did you feel that on? Okay, good. Good. Excellent. And what side of your face did you feel that on? Very good. Yes. Very good. 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 Very good. Yes. Yes. Good. Okay. Try again. Okay. Okay, so we have this area. I'm going to apply some more tincture to this area, okay? Okay. Good. Very good. Okay, let me smooth that out then for you. Okay. Sharp or dull for me? Yes, very good. 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 Excellent. Very good. 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 Yes. Yes. That was dull, yes. Dull, yes. Dull, yes. And where was that? Okay, on your right side, good, okay. Sharp or dull? Sharp or dull? Which side? Good. Sharp or dull? Which side? Good. Sharp or dull? Good. Which side? Excellent. Okay, and this one's on your nose, yes. Okay. Just a few more. I'm just going to go through a few more with you if you don't mind. Okay. Good. Good job. Yes. Yes. Sharp or dull? Good. Sharp or dull? Good. Sharp or dull? Very good. Sharp or dull? Excellent. Okay. Alright. So this is an exfoliating brush, okay? So once I put the serum and the moisture on your face, this is really going to stimulate all of the movement beneath the cells and get rid of some of that dead skin. Okay, so I'm just going to be rubbing this all on your face. It's going to feel a little ticklish. It shouldn't itch and it shouldn't feel painful. Alright? And you can go ahead, close your eyes and relax. Okay. Okay, good. Okay. 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 Excellent. Do you feel that working? I'm so glad to hear. Okay. bear with me here. Okay. Okay, I'll go a little more gently. I'm sorry about that. Okay. It is hard to tell sometimes. The skin reacts differently, but so far it looks good. It should look a little red, and it's going to stay that way for about 20 minutes, but you're going to feel very refreshed, and you're going to start to notice it this evening. Okay. Just a little more. Very good. Excellent. Okay. Okay, very good. Okay. Which side of your face do you feel this on? Okay. Which side of your face do you feel this on? Okay. Where do you feel this? Okay. Where do you feel this? Okay. And is this cold? Is this cold? Is this cold? Is this cold? Good. It should feel cold. My fingers are very cold today. Okay. Good. Okay. Alright, and now I'm going to take some measurements of your face to make sure that it's symmetrical. Okay. Great, and this is just to check for any lymph node swelling. I know I already did with my fingers, but this is just to validate the process and then to have a record of your facial measurements. Okay. Can I come a little closer? Okay. Okay, good. Okay, that's 7 on the chin. Okay. Okay, that's 9 inches here. Okay. 4.5 here, so that's 9. Excellent. Right here. Just try to hold still. You can close your eyes if you want to. Okay. Tops of your head. Okay. On the top. Okay. Okay. Excellent. 14. 7 on this side. 7 on this side. So I'd like to do a quick acupressure. Okay. Just in case of any irritation, what this is going to do is just really reduce any kind of swelling that you have and just influence the drainage on the sides of your face right here. I'm going to be hitting pressure points along your cheekbones, alright, and right here under the eye, okay, in those tear ducts. Okay, good. Okay, so just hold still. Okay. Okay. Good. Just feel a little bit of a pressure. Good. Excellent. Good. Other side. Good. 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 Oh, I'm so glad it feels good. Doing it again. Alright, I'm going to go down along the sides here. Also be hitting your chin. Okay, good. Excellent. Good. Very good. I'm going to be doing the top of your forehead very lightly, okay? So just hold still. Good. Good, good, good. Good. Very good. Excellent. Good. I already see some swelling that has gone down. You didn't have a lot of initial swelling, but we all wake up with a little bit of puffiness, especially as we age, and I see a lot of that has gone down, and your face looks actually very radiant. Okay, so we did test on your hair and your face. I think I calmed down the irritation of the skin in the area. Okay, how do you feel? All right. Okay, I'm going to go ahead and make in some notes. So you definitely have dry type skin, okay? The fact that the tinctures I applied worked means it's very good. They're all aloe vera based. I'm going to be sending you home with some, okay? And then prescription, you're going to pick it up at the store, okay? I'll give you a slip. So these are just topical treatments. One is a leave-in conditioner for your hair. The other is a shampoo. And then I will be sending you home with that oil that I applied, okay? Use that sparingly because we don't want to, we want to test and make sure that it doesn't break out your skin. So for the first couple days, I would use it sparingly. If you don't notice any breakouts, go ahead and keep using it. I'll be sending you home with some cream and moisturizer that you can use more generously, especially at night, okay? Very good. Okay, great. Do you have any questions? How did that feel for you? Okay. All right, excellent. So I'm going to go ahead and schedule a follow-up appointment for next week. Okay, are you available at the same time? Okay, 10 a.m. So I'll be giving you the results of your lab test next week. And also I'm just going to be checking the area and making sure that it's improved, the swelling has continued to go down, and that the redness has gone down, and that you're on the track for proper healing, okay? Great. Okay. It was such a pleasure to meet you. Other than that, your skin looks extremely healthy. I hope you enjoy your new haircut and have a beautiful rest of the day, okay? All right, bye.